I'm a second generation dentist. My dad inspired me to become a dentist. As a kid, I got to see how my dad affected people's lives, and that's really transformational for you to see as a child, and that made me want to go into the career path of dentistry. You know, when I was in dental school, getting an impression was really difficult. It's one of actually the least favorite things I learned in dental school was how to take an impression with goop. Something I struggled with as a dental student. I remember thinking, wouldn't it be great if at some point something came along that made it to where I didn't have to do this stuff anymore? And magically something did, and that thing was iTero. Most people think of the iTero scanner for orthodontics or for Invisalign, but it actually works really great in a GP's office for everything from new patient exams, recall patient exams, anything in the hygiene room where I have to educate a patient, any restoration I need to do, a crown, an inlay, an onlay, a veneer, a bridge, even an implant, and of course at the heart of it all, Invisalign. iTero scanner can do all those things, and it's made it to where I haven't had to take an impression in I don't know how many years. I bought my iTero to do restorative dentistry, and I loved all the flexibility that it gave me in doing restorative, whether that was marking margins, separating the dies, being able to give my laboratory the most amount of information possible. What I didn't realize is all the other things I would use the iTero scanner for. We started using it to help patients see and understand what was happening in their mouth, which made them much more likely to say yes to the treatment that we recommended. Getting a patient to say yes to treatment is 98% of the battle. Once they say yes, the execution of the treatment generally is pretty simple, and the iTero scanner is absolutely perfect for getting a patient to see and understand what their dental needs are. My production and collections increased almost 33% after we started scanning patients in the hygiene room. We saw the same number of patients, it's just that we are getting so much more case acceptance because they can see and understand what's happening in their mouth, thanks to the iTero scanner. If you want to do more dentistry, it's pretty simple. Just get an iTero scanner and start scanning patients with it. Whether that be routine dentistry, comprehensive dentistry, or Invisalign, there's nothing I've ever purchased for my practice that has had the same return on investment that the iTero scanner has. Nothing even comes close. It has been a huge game changer, so much so that it's forced us to move to a new facility that's twice the size, and I call it the house that iTero built.